Question, Carol.
Yes.
Someone is saying that they are on Depo-Provera.
Yes.
And they are adding weight.
Yes.
And they are concerned.
Yes.
What would you advise?
Those are some of the side effects that comes with the hormonal methods, but now the same methods also for some moms they add weight, others they lose weight. So on adding weight, we may also want to rule out some of maybe the lifestyle the mother has, because it may not come necessarily that it is the method that is causing her to add weight. We may also, maybe when you're assessing, you assess about the lifestyle, maybe the mother has also changed the lifestyle. Because the reason I am asking, I'm saying this because the same methods adding of the weight, and others they lose weight. So even mother says about the change of weight, we rule out even the change of lifestyle as well. But if she feels it is the method causing the adding of weight, we advocate for change of method.
Okay. There's another question.
Yeah.
On YouTube.
Yeah.
Is it normal for one to miss their periods while using an implant?
Yes. Yes, I talked about the disturbance of the pattern of a woman's period. I talked about irregular period. I talked about lengthy period. I talked about prolonged period, and I talked about failure to experience the menses with the hormonal method. It is very much okay.
Okay. Joy on YouTube is asking.
Yes.
Is asking you to highlight.
Yes.
To highlight the advantages and disadvantages of IUCD.
IUCD.
Is it IUCD or IUD? IUCD.
Yeah, the IUD comes in different form, but now what we normally have majorly, in most of our facilities we have the IUCD, which is the copper T. Yes. About the IUCD, once it's a long-term method, you don't have to keep on worrying when to go back to the clinic. It's a long-term method, so you don't have to frequent the clinic for the family planning method. Another advantage, it is non-hormonal, so it doesn't affect your hormonal balances in your body. It is just a foreign thing that is normally put in your uterus that prevents the sperm and the ovum from meeting. And then you have another advantage with the IUCD. You don't experience the side effect that comes with the hormonal methods, especially the BP, your blood pressure, your weight. It doesn't have your dizziness. Those are some of the advantages with the coil. And then for a disadvantage, you have minimal disadvantage with the there's some mom who experience lengthy bleeding when you have the prolonged bleeding or the heavy bleeding with the IUCD. There are some who complain of back pain. There are others who complain of majorly. Those are the major complaints that you experience from the mother using the IUD. But the good thing with the IUCD, the level and the level of efficacy when using the IUCD is very high as compared to the short-term method. Maybe another complaints about how it is started and some things, but it's very okay. It's a normal way you give birth when it's being inserted, and then it's normally just a 5-minute thing when you have a well-trained midwife or a nurse when inserting the IUD. Maybe those are some of the side effects, but the IUD what do you say? It has less side effects as compared to the hormonal method. Yes.
Okay. There's a question on Zoom.
Yeah.
What did you mean when you say one can't get pregnant while breastfeeding when it's done correctly? What do you mean? What did you
What
mean?
it means is when exclusive breastfeeding is being done and being done correctly, that is proper attachment, and you're doing it day and night. Most of the mothers, we have that lactating amenorrhea. You don't receive your periods, no spotting, no periods at all.
Sorry.
Telkom line.
Mute. Oh, sorry, Carol. I need to mute. Oh,
Telkom line. 1,000 after GB mob, sir.
what? Please mute yourself, whoever it is. Did they ask to mute? Carol.
Yes.
Carol, go on.
What I meant is when you talk about lactating amenorrhea is where a mother do not experience the ovulation is not yet, it's not back. Your mother does not ovulate when you do exclusive breastfeeding and you're doing it right, you do not receive your period. That's in fact, lactating amenorrhea is considered as a natural method. But now, because you don't know if a mother is doing exclusive breastfeeding well, that is when you advocate to use another method at 6 months. But if a mom, yes, at 6 weeks, sorry, yes.
Carol, another question.
Yes.
Does IUCD cause fibroids?
No, it is not associated with fibroids at all.
Okay. Yeah, that question came from YouTube. I think YouTube people are asking very many questions. Okay. Any other questions? Or anything maybe what you want Carol to address while we still have time for this?
Okay. Not aside. Oh, I'm sorry about this. I forgot to mention condoms as a family. That in fact is the only method that prevents you from getting pregnant and also prevents STIs. Condoms are also family planning methods. Yeah, that's something I'd forgotten to mention and to highlight when I was talking about the family planning methods. Condoms are there. You have the female and the male condoms, and they are the only family planning methods that prevent you from getting pregnant and also getting the STIs. But the rest only prevent you from getting pregnant, but the STIs, if you have multiple sexual partners, you can get an STI with the other methods. Another thing about the IUD, this is another thing about IUD, you have to be very faithful to one sexual partner. Otherwise, because of the strings that are normally left hanging after the insertion, if you have multiple sexual partner, then you're at a high risk of getting frequent STIs infections. And then with the IUD, proper hygiene, it's mandatory. That if you don't observe hygiene and you have the IUD, high chances of recurrent UTIs, the sexual transmitted diseases. If you are not faithful to one partner, then you are at high risk of getting the infection.
Okay, I'm seeing people are still joining. Yeah, people are still joining. Questions, ladies? Questions or concern, even if it's not a question? Your experience as well?
Yeah, by the way.
Experiences, maybe you can share your experience. Like Esther has shared her experience, and we can have someone else sharing their experience. So Carol, about adding weight is the same way. Is the same you answer the same way you answered about adding weight. Is the
Yes.
same way the person who is losing weight,
Yes.
yeah, would take it.
Yeah.
Okay. Okay, let me see this. Okay. All right. Okay, maybe a general question.
Yeah.
If you're good with family planning, a general question. I'm actually moving from YouTube to Carol. What is your take? Or you have Carol, you have a 9-month-old baby.
Yes.
What is your take on pacifier? Because I don't see, that question was addressed on Saturday when you had a feeding class.
Yes.
And then again, it came back after the class. What is your take on pacifier? Do you give your son, your very beautiful son, pacifier? Did you give?
No, I've never used a pacifier myself.
Mm-hmm.
Reason is sometimes, you know, when a baby has this pacifier and you want this baby to learn how to talk, you want this baby to you want to hear the baby make those noises. When the baby has the pacifier, you guarantee that this baby is always remain mute. Eh? Hello, Mercy?
Hi.
You can hear me?
Yes, I can hear you.
Yes, so but this is my own opinion anyway as a mother.
Mm-hmm.
I would not advocate for the use of pacifier. Then another thing, it has something that the baby keeps on sucking inside, yeah?
Mm.
The baby is always kept busy sucking that thing inside, yeah?
Mm-hmm.
So if a baby is like now for a 9-month-old, the baby is learning how to talk, how to make those sounds, how to what do we call them now? But majorly making sounds. It will prevent this baby from achieving that milestone if the baby is always on a pacifier. But there is another case scenario where I had a kid that is being brought up by the grandmother. The mom passed on after delivery. I found it appropriate for that case for baby to use pacifier. She told me about. She normally uses it at night when the baby sleeps with it. So when the baby wakes up, feels that there is something they are sucking in, it helps the baby to sleep before the grandmother wakes up to mix out the formula. I found it appropriate for her case to use pacifier because it is simplified anyway her work. But if you're with your baby as a mother, I wouldn't advocate for it. I don't know if I've helped or.
Yeah, I actually remember answering that, and I told them I think it should be a personal call.
Yes.
Someone should make a decision on her own.
Yes.
Because there was also the issue of hygiene in it.
Yes.
Yes, yeah. So actually, and then they're so beautiful pacifiers. They're so, they're really, really nice, and moms really love them. Okay, we have 3 questions on family planning.
Yes.
One is I think on the 2 on YouTube.
Yes.
Joy is asking, which is a method that is used mostly? Family planning that is method that is used mostly.
Mm-hmm.
And then there is a question also from YouTube.
Yeah.
Mary is saying she's been using oral pills
Yeah.
for some years and they work well for her. How many days in a cycle can one conceive? Okay. Let me read the other one. You talked of being faithful to one partner.
Yeah.
What if the other partner is not faithful and you're using IUCD? Yeah, that's a big concern because you can't be faithful yourself, but you don't know your partner, what your partner is doing. And the last question we have is, what do you mean No, that's a correct. That's a. Do you? Okay, answer those ones as I figure these other questions.
The most common used methods, majorly they are the short-term methods, the injection and the pills. But now with with the current the creating of awareness of the long-term method, majority of moms are picking up the long-term method, the implants and the IUD. But the short-term methods are commonly used by mothers. About your partner not being faithful, well, no, that is quite unfortunate if the partner is not faithful and the other partner is faithful anyway. It's quite unfortunate. What do you do?
So would you advise her to use IUCD if she has a partner who is not faithful?
In fact, now if you have a partner who is not faithful, advocate for the condoms. Because now if the partner is not faithful, then you're also at risk. You're not only at risk of infection, but you're also at risk of the you're not only at risk of the STI, the
Pregnancy.
UTI, but also the pregnancy, but you're also prone to STIs, the HIVs, the gonorrhea, such the syphilis. So for her case, if your partner is not faithful, advocate for condoms.
Okay.
Yes.
You're saying something? Do IUCD bring infection?
Yes. I mentioned, if you don't observe the hygiene, not faithful to one partner, or your partner is not faithful to only you are prone to infection. Frequent and recurrent infections for that matter.
Okay.
Yeah.
Sawa. Any other question? I think from my side, I don't have any question. Ladies, unless you have a question related to family planning or anything else, Carol, maybe what would you want to tell moms? Maybe you as a mom who's you had your baby last year, isn't it?
Yeah.
Yeah, maybe just encourage them. They have small babies.
Yeah.
Maybe what would you want to tell them? And especially your baby is feeding very well. I saw him.
Yes, I thank God he's a very good feeder. I thank God for that. And for any mother who is out there with a small kid, that is one thing. That kid is one thing that should just give you strength to move on. Don't give up. Don't give up on your baby. Focus on your baby, concentrate on your baby, love them. They're just okay, and they just make your day feel good. Even you just see them, even after a long day working, when you see them, just love them. Just work with them with their growth milestone. Just be there. Just have that interest with your baby. Observe them. Any minor changes that they make, it makes you feel good. And for mothers who have the poor feeder baby, don't give up on them. Don't give up on them. So long as the baby is okay, the baby is not sick, the baby is taking that small amount, and if that should just encourage you. Feed them, try all means to take care of them. About the family planning method, go for that method that works for you. If one method has failed, that one should not discourage you. Seek that healthcare provider advice, and we have variety of them. And I'm sure not all of them are going to need to fail on you.
Okay. Thank you so much, Carol.
Yeah.
If there is no question, ladies, I'd like to release Carol to go back to work. As you can see, she's at work. So unless you have any other questions, we're here to answer your questions and support you. But in case we don't have any other question, we'll release Carol. to go back to work. Now, okay, is it a question? I'm saying someone is joining now. Okay.
We can let them in and maybe give them a chance to ask any question.
Okay. Carol, how do moms take care of them of the babies now during COVID? Maybe what experience or what can you tell them when they're coming to the clinic with the babies? How do they take care of themselves, the babies? Maybe some tips on that as we wait for the ones who are joining.
About COVID and the small babies? One is just stay at home, avoid unnecessary movements that is going to make you
Expose you?
Yes, exposed. Just be at home. If you're working mom, when you go to work, just take care of yourself because your baby's health depends on you. When you're breastfeeding the baby, it's very hard for you to put on a mask at home when you're with your baby. So when you go out there, just take yourself. Use the guidance that are there. Use your mask, social distancing, washing your hands and sanitizing. As that is the only way we can keep safe for our babies, especially for working mothers. But stay at home, mom. If you stay at home, mom, just avoid unnecessary movements or visits. Just be at home with your baby. That's the best way we can prevent our babies from getting the COVID-19 virus.
Okay, Carol, there's a question. What if while breastfeeding, you use the pills that don't interfere with milk supply? I can't recall the name.
Microroots?
Maybe Wanjiko will tell us. I can't recall the name, but they have so many side effects, including nausea.
Yes.
What is it supposed to do? What is one supposed to do?
With the initial use of these methods, those are some of the side effects that you experience as a mother, both the nausea, the headaches, the stomach discomfort. But with time, the body gets used to it, and some of these side effects just go.
Okay. I hope, Wanjiko, that is answered. Carol, I'm seeing another question. Someone is asking, can you start family planning immediately after delivery?
Yes, like the IUD, there's some moms that the ones who get new ukipata mtoto, the ECD
Is it started?
Yes.
And that doesn't have a problem with this because it's not hormonal. It won't have a problem with breast milk.
Yes. So
it's safe.
Yes.
Okay, YouTube has very many questions. Let me go back there. Is it true that pills don't work for plus size moms?
No, but now weight, pressure, those are some of the things that we screen before a mom starts any method. So with the plus mom, we have to consider some other things before giving any method.
So it's not about the weight, it's actually about maybe what she's going through.
Yeah.
Okay. So, okay. Yeah, that one advance with us. Okay, good questions from YouTube. And I'm seeing Sally is joining us. Oh my goodness. Joining when we're almost going.